What is hypothyroidism and how does it affect you? In this video, I'm going to discuss what hypothyroidism is and give a high-level overview of the biological processes behind it. I'm also going to discuss some of the most common causes of hypothyroidism, as well as some of the complications and various ways that hypothyroidism can affect your health. So let's start by discussing the thyroid. The thyroid is a small butterfly-shaped gland that drapes across the front of your windpipe. If you place your fingers on the sides of your Adam's apple and swallow, you will feel the thyroid gland slide under your fingers. It releases thyroid hormone, which controls the growth and metabolism of essentially every part of your body. But if you're going to discuss the thyroid gland and hypothyroidism, you have to discuss the pituitary gland as well. The pituitary gland is a tiny gland in the middle of your head that monitors your physiology and releases thyroid-stimulating hormone, also called TSH. TSH, from the pituitary gland, is the signal to the thyroid gland to release thyroid hormone. Sometimes TSH levels increase, but the thyroid gland can't release more thyroid hormone in response. And when this happens, this is known as primary hypothyroidism, because the problem begins at the level of the thyroid gland. And other times TSH levels decrease, the thyroid never receives the signal to increase thyroid hormone levels. This is called secondary hypothyroidism. Hypothyroidism is also called underactive thyroid disease, or simply low thyroid, and it's a common disorder and it can cause a variety of signs and symptoms. The thyroid controls how your body's cells use energy from food, the process of metabolism. And among other things, your metabolism affects your body's temperature, your heartbeat, and how well you burn calories. If you don't have enough thyroid hormone, your body processes slow down, which means that your body makes less energy and your metabolism becomes sluggish. The symptoms of hypothyroidism can be vague and often mimic other conditions. And these may include changes in the menstrual cycle, constipation, depression, dry hair and hair loss, dry skin, fatigue, greater sensitivity to cold, slow heart rate, swelling of the thyroid gland, unexplained weight gain or difficulty losing weight, carpal tunnel syndrome, and that's just to name a few. The next video in this playlist has a very comprehensive list of symptoms, so make sure that you check that out. Causes of hypothyroidism. The most common cause of hypothyroidism is Hashimoto's thyroiditis. Thyroiditis is an inflammation of the thyroid gland, and Hashimoto's thyroiditis is an autoimmune disorder. With Hashimoto's, your body produces antibodies that attack and destroy the thyroid gland. Thyroiditis may also be caused by a viral infection. And some other causes of hypothyroidism include radiation therapy to the neck area. Treating certain cancers such as lymphoma require radiation to the neck. And radiation damages the cells in the thyroid, which makes it more difficult for the gland to produce the thyroid hormone. Radioactive iodine treatment. This is a treatment that's commonly prescribed to people who have an overactive thyroid gland, a condition known as hyperthyroidism. However, radiation destroys the cells in the thyroid gland, so this usually leads to hypothyroidism. Certain medications to treat heart problems, psychiatric conditions, and cancer can sometimes affect the production of thyroid hormone. These include amiodarone, cortisone, pacirone, interferon alpha, and interleukin-2. Thyroid surgery. Surgery to remove the thyroid will also lead to hypothyroidism. If only part of the thyroid is removed, the remaining gland may still be able to produce enough hormone for the body's needs. Not enough iodine in the diet. The thyroid needs iodine to produce thyroid hormone, and your body doesn't make iodine, so you have to get it through your diet. Iodized table salt is rich in iodine. Other food sources include iodine, shellfish, saltwater fish, eggs, dairy products, and seaweed. And so thanks to the availability of iodized salt in the US, iodine deficiency is rare in our country. Pregnancy. The reason isn't really clear, but sometimes inflammation of the thyroid occurs after pregnancy. This is called postpartum thyroiditis. Women with this condition usually have a severe increase in thyroid hormone levels, then followed by a sharp drop in thyroid hormone production. Most women with postpartum thyroiditis will regain the normal function of their thyroid. Problems with thyroid at birth. Some babies may be born with a thyroid gland that did not develop correctly or does not work properly. And this is referred to as congenital hypothyroidism. Most United States hospitals screen babies at birth for congenital hypothyroidism. Damage to the pituitary gland or pituitary disorder. Rarely, a problem with the pituitary gland can interfere with the production of thyroid hormone. And as we have already discussed, the pituitary gland makes the hormone called TSH, thyroid stimulating hormone. And that hormone, TSH, tells your thyroid how much thyroid hormone it should make and release. Disorder of the hypothalamus. An extremely rare form of hypothyroidism can occur if the hypothalamus in the brain does not produce enough of a hormone called TRH. TRH affects the release of TSH from the pituitary gland. Now let's discuss some of the complications of hypothyroidism. If left untreated, hypothyroidism may cause heart problems, infertility, joint pain, and obesity, just to name a few. It's also a big problem in pregnant women because not only does it affect the mother, it can also affect the developing baby. During the first 3 months of pregnancy, the baby receives all thyroid hormone from its mother. So if the mother has hypothyroidism, the baby doesn't get enough thyroid hormone. And this can lead to problems with mental development. In cases where there are extremely low levels of thyroid hormone, it can cause a life-threatening condition called myxedema. Myxedema is the most severe form of hypothyroidism. A person with myxedema can lose consciousness or go into a coma. And the condition can also cause the body temperature to drop very low, which can cause death. Without treatment, you may have a higher risk of heart disease. That's mostly because people with hypothyroidism may have high levels of LDL or what we call bad cholesterol, which can cause fatty deposits in your arteries. Hypothyroidism can lead to an enlarged heart and heart failure. The bottom line is that hypothyroidism is a common disorder that can affect just about every system in your body and therefore every aspect of your life. But an important thing to remember is that just having one or more of these problems doesn't necessarily mean that you have hypothyroidism. If you're having several of these symptoms, or if they are new, or if they're worsening or severe, it's a good idea to schedule a checkup with your doctor to discuss your symptoms. And if you'd like to learn more about the safest, natural, and only way to truly overcome hypothyroidism, I'd like to invite you to a free presentation that shows you exactly what other people are already using to help them stop hypothyroidism directly at the source and take back their lives. I'll leave a link in the description for that presentation, along with links to some other valuable resources. I also would like to invite you to leave a comment below about your own journey with hypothyroidism, what you're struggling with, what you've learned, what's helped you, where you may be stuck. Your journey, your experience, your wins, your losses, your pains, the things that you've learned along the way are so valuable. So if you're so inclined, please feel free to share. And finally, I'd like to thank you for watching. And if you got value from this video, please leave a thumbs up and consider subscribing. Be sure to stick around for the next video in this series. Thank you.